is a pleasure to have been able to present the 2016 ESC guidelines on atrial fibrillation here in Rome. It's a wonderful, sunny place, over 30,000 people here, and very friendly Italian people here. Atrial fibrillation is a chronic disease that is dangerous, and the management should comprise 5 domains. 3 of those domains have a prognostic impact, which means they can prolong life and they can prevent serious complications. They are the following. You need to stabilize the patient hemodynamically acutely. You also need to detect and treat underlying cardiovascular diseases, such as heart failure, but also hypertension, diabetes, obesity, valvular heart disease, and coronary heart disease. And then, of course, you need to assess stroke risk of the patient and then decide on anticoagulation. Patients who have 2 of the CHA2DS2-VASc risk factors, and that applies to women with a CHA2DS2-VASc score of 3 and men with a CHA2DS2-VASc score of 2, have a clear indication for oral anticoagulation to prevent strokes. In patients in whom non-vitamin K antagonists can be used, the ESC guidelines recommend to prefer NOACs over vitamin K antagonists because they are safer in terms of intracranial hemorrhage, and there is a 10% lower mortality, both in the phase 3 controlled trials and in observational data sets. Patients with one of the CHA2DS2-VASc factors, i.e. women with a CHA2DS2-VASc score of 2 and men with a CHA2DS2-VASc score of 1, should be considered for oral anticoagulation. Some of these patients have a relatively low stroke risk, whilst others may have a high stroke risk. And we have some evidence that stroke rates can be reduced by anticoagulation, but the evidence is not as clear. Patients without stroke risk factors do not need antithrombotic therapy.